And then
Yes, please
yeah,
continue.
and then I booked my practical one on November, in November 8th and 9th. And then I have enough time to take a rest after finishing the written exam. And I was sick after the written exam. So I took a rest for a while. And also I was a student to get visa. So I focused on like my college after 3 months, the 3 months late after the written exam. So for me, while I just slowly collecting the dental equipment, dental home setup, and then collecting the information little by little. And then I started, and I also went back to my country as well. And after coming back from my country in July, and in mid of July, I started to prepare for practical examination. So technically, I spent about 4 months for practical examination. And actually, I had a long experience as a dentist in my country. So I would say for practical one, my experience worked very well. But I learned everything in my language. So the hardest part for me is like communication or ski rather than technical task. Because I have never worked in Australia, so I have never seen the dental practice in Australia as well. So I needed a lot of example of expression, how the dentist asks question to patient and how do they manage their concern or something. So I mainly focus on OSCE communication. Yeah, I would say. Yeah.
All right.
Yeah.
So you said that you roughly prepared for 4 months. So how much
Yeah.
practice did you do each day? Just to interrupt you here, Dr. Mustafa Taha, I think you have joined. And
Yes, hi, how are you?
how are you? I'm doing good. And congratulations to you on clearing the exam and taking the time out to
Thank you.
join us and help other
Thank you.
candidates.
Sure,
I will
thank you.
just be asking questions so then both of you can answer in a sequence. All right. So my first question to Dr. Wakako was that how did she prepare for the exam and how long it took? So she has already answered that. So it will be really nice if you can answer that as well.
Yeah, sure thing. Now, first of all, I have done my examinations 2 times. I failed the first time, and I passed the second time. My first time was in May last year, and this one was in December, just last year as well. How did I prepare? Is mainly I depended OSCE on your notes mainly. That's what I was reading, but the way I was reading is, of course, understanding every subject in a very good way because I learned from my first exam that because it was my first experience, so I learned that cases usually change a lot and they just add some technical questions around. So yeah, that's basically it. For
So,
my
like you mentioned
technicals,
that you attempted the exam 2 times. So,
yeah.
what would you say that how long did you prepare? Because I do understand that from the last attempt in May until this attempt, you are not preparing the entire time, right?
No, the last time only the last month. The first time I try it was around, I would say around 3 to 4 months of preparation. I work all the time, so I usually study around 1 hour to 30 minutes a day if possible. On weekends, I take around 2 to 3 hours.
Okay, all
That's
right.
basically it.
So basically, I think you both would agree with me when I say this is that it's not like the written exam that you need to grasp everything. It's about uh, perfection with the tasks and the criteria that the ADC expects. Some candidates will take a month, some will take 6 months. So it's candidate dependent. Someone who's in practice, someone who's doing routine dental work might be a bit more familiar and have the grip over the handpiece and have that smoothness and perfection achieved quickly compared to someone who's not working. All right. My second question to you would be that how much practice did you do each day?
Practice. I would say if it's technical, you're talking about technical?
Yeah.
Technical, as you said, because I do lots of restoration, and the surprising thing in my exam, they added some extra teeth. If you remember, I told you, which was
Yeah.
the lower molar, which I have never practiced in my life on, but I passed that task. It's just because, as you said, there are certain criterias. ADC are very clear about it. And just follow these criterias, and I believe we will pass. So how long will it took me? I would say every day around. I used to train on a tooth or a task, for example, amalgam. I would take like one or two teeth, but I would say 2 weeks tops for my technicals.
All right. What about you, Dr. Wakako?
Yeah, so regarding technical, I just practice actually less than 20 days. But I thought I mainly I've never done amalgam in my life. So I try the one day I just do amalgam. One day I just composite resin. One day I just focus on preparation so that I can understand the criteria very well. And then I can be familiar with the Columbia Jaw model. And then so once I understand the criteria and then how to fix it, and then after that, I mainly focus on mock. So I just focus on one day, just technical, and try to finish. I usually finish less than 4 hours usually, but even I used 6 hours, exactly 6 hours in the technical, because I can see the ADC try to make the question more difficult by tilting the piece and then make the box very deeper than I thought. And also the neighboring piece is rotated. So this is how ADC exam getting a little bit difficult. Yeah, I would say. So
all right. Now the thing is the next question, sorry, excuse me. The next question to both of you is that, of course, you were practice technicals. I will just focus on technicals and then I'll come to the other part. So when you're practicing the technicals, of course, you need to know that are you following the right path? Are you following the criteria or the marking rubrics that the ADC expects from the candidate? So how did you make sure that you are doing the right thing?
Should I start?
Yeah, anyone of you can start. Yeah. Yes, Dr. Taha, you can start.
I can start. Okay. Now, how would I know everything is correct? First of all, now that there are videos you provided in the portal, they were very, very clear to me. They helped a lot. And the second thing, I had the ADC criteria. It was right in front of me when I was practicing. So it was pretty clear, just, get 1.5 and you have specific bursts for that. So I didn't have anyone watching my work, except when I told you when I went to Australia, I took 1 day of technical. If you remember, I told you dental 101. So 1 day with technical just to make sure everything is all right. So at home, I used to practice and look at the criteria, look at the videos, and that's actually what I did. And as I told you, it shouldn't take more than 2. If for a practicing dentist, I don't think it should take more than 2 weeks.
All right. Thank you for that, Dr. Wakako. Can you share your experience?
About technical, right?
Yeah.
Criteria. So I actually combined with online your course and also on-site course in Sydney. And I combined with the both information, even if I am assessed by one tutor in on-site course. But I also ask you to assess my work after test. So that I can get more useful information, and then also I can go with this the criteria. And I think the most important thing is understand the criteria, and then the experiment yourself many times, experiment, and then experiment and then how figure it out what way you are most comfortable to fix it for some issue. Yeah, so this kind of thing is just done by you, like the candidate.
Okay, all right. So just wrapping up the technical part, a very important question is with regards to the home setup. Some candidates feel that they don't need a home setup. Some candidates feel that it's compulsory. Some candidates say that we'll just go to an institute and practice for 1 to 2 weeks and that will be fine. So what is your opinion regarding home setup? By home setup, I mean having a setup at your home or working at a clinic where you work and practicing the task. So what is your opinion with respect to that? Dr. Taha, you can start.
Yeah, for my own experience, as a dental setup, I didn't have the perfect dental setup, and I don't want people to get really stressed about these things because at the end, when you work in the examination itself, especially for people who are doing it the first time, please understand it's not a complicated thing. Yes, you need to do indirect vision. Yes, you have cheeks around, but you have a plenty of space in the patient's mouth. So for my own setup, honestly, I only had the two jaws and I improvised. I used to put the two jaws in an articulator and I used to just fix them over the head chair. And that's how I used to work. I didn't have
So you
cheeks. I didn't
practice
have a
the
full
task
setup.
on your on a dental chair.
Dental chair. Yeah, I just used to put the two jaws on an articulator, fix the articulator on the head, and just put it on the back and just worked on that. I did that I mean, I passed all the technicals for both exams. And the problem is when I was doing the exam, I remember like people used to complicate things. Get the motor, you have to practice every day at home. Yes, maybe for non-practicing dentists, they might need more practice, but even for non-practicing dentists, please understand the criteria is very clear. Just follow up the criteria, and it's not an impossible exam. That's all I want to say.
Thank you for that. Dr. Wakako, your experience?
Yeah, I'm based in Sydney, so but I invest my time to focus on ADC. So I'm not working here as a dental assistant. So I bought a home dental setup. But I mainly purchased I purchased the important thing like unit and handpiece thing and then jaw. I bought from One Dental because I don't want to be bothered by broken instrument. But when I was in my country, I have easy access to dental material. So I bought some material in my country by asking friends to purchase it. And also I purchased something which is cheaper here. Yeah, I purchased from the on-site course as well. So I combine this, what I have.
Okay, that's fine. Thank you. So just summarizing it, that the thing with the home setup is that you don't really need to have it at your home. You can even have it at your clinic. You can just have the mannequin and jaws and just practice on the clinic. But the thing is that you need to practice. It's not that you can just book a course and for 1 week you can just practice the task and then go for the exam. That's not possible because sometimes when you're practicing repeatedly, you need to see if you're fitting yourself in the criteria. That's the most important thing. And that comes with practice. For a clinician who's practicing dentist, it might take maybe around 5 to 10 teeth. But for someone who is not practicing, it will take time. All right. So the home setup does not necessarily mean that you need to have the best one and everything. You just need to make sure that it's functional, it's in a working condition, and you can practice the task repeatedly, especially for those tasks which are not often done as a clinical practice of dentistry, like amalgam, like access cavity preparation, because these things we usually do, like an access cavity on a tooth that is grossly decayed. But on the day of the exam, you need to practice this task on an intact tooth. So practice makes you more confident, all right? So the more practice you do, the more confident you will feel with the technical task. The number of times that you need to do practice depends on each candidate. Not everyone is same. I have some candidates who have done it like maybe in few weeks, some have done it in 5 months, some have done it in 2 weeks. So it all depends on where you stand once you start practicing. You will only know where you stand once you start practicing, and then you will analyze difficulty level and then go stepwise towards improvement. All right, thank you for the technical feedback. Now coming on to the communication. How was your approach to communication? Since this is something completely new, even for practicing and non-practicing dentists, because we usually don't talk to patients that way. Even in Australia, when we are seeing patients, we are not talking to the patient in the way that we have to talk during the exam. So how was the preparation that you had to do for the communication OSCEs? Dr. Taha, you can start with it.
Yeah. Now, I just want to add something from my experience on the communication OSCEs, which I think really important to us. Now, please understand in the communication OSCEs from my experience is they don't actually look for your dental knowledge more than
Mhm.
how you react to the patient.
Mhm.
So this is the difference between people passing and failing, I guess, because I remember when I was reading around my friends, and some of them was really into details about how to present the case, on how to talk
Mhm.
about medications, on
Mhm.
yes, you need to know these knowledge. You need to know the basic knowledge of drug interactions, and I think everybody knows it after the written exam. But it's not as complicated as it's only on how you respond to the examiner, and you have to deal with the examiner as he is a patient, not a doctor.
Mhm.
Your answers has to be really clear to
Mhm.
on as a patient. Now, how did I prepare? As I told you, I just literally read the notes that you gave us. So if there are some points which are not clear, I used to ask you directly, and
Mhm.
or just look for it online for any subject
Mhm.
if I needed more knowledge about, just to be able to answer the examiner if there was some other questions apart from we got. But again, it was never about the knowledge. It was never about, hi, my name is Dr. Taha and I have to
Mhm.
follow up a full criteria. For
Mhm.
example, one of the cases I had an angry patient, and
Mhm.
you even told me that before the exam. Like, I literally had no time to ask any question. The patient was literally yelling. She
Mhm.
was very angry.
Mhm.
And the way to pass that case is not by asking question, is just by clarifying things to the patient
Mhm.
and just ease her mind.
Okay.
So
All right. And what
yeah.
about the practice? Like, did you practice present your cases to someone? Of course, you did practice with us. You had
Yes.
sessions with us. But apart from that, did you have an OSCE partner through which you used to practice daily or something like that?
I honestly did not. The only sessions that I was practicing is with you, which is that we got the two sessions.
Mhm.
We've got some cases, and the rest of them I was practicing with myself. Like, I used to ask the questions
So
myself,
having an
and
OSCE partner is not really a compulsory requirement.
it is not actually. No, it is not. I mean, if you want to get more confident on speaking to someone, and
Mhm.
that would make a difference for me.
Mhm.
It wasn't a huge difference.
All
Uh,
right.
but yeah, I think that
Okay.
I hope that
Thank you for
answers your
that.
question.
And Dr. Wakako, please, your experience with the communication
Yeah,
preparation, how did you go about it?
yeah, I agree with Mustafa. And because ADC checking just your customer service level, or
Uh-huh.
like how do you respond, or how do you listen to the patient, how do you manage the
Mhm.
patient. This is
Mhm.
not the something that like say everything in 10 minutes. So I
Mhm.
see a lot of candidates are overwhelmed themselves by
Mhm.
like taking all the question, all the information, and then they forget mainstream.
Mhm.
So I think keep it simple. And then
Mhm.
just because there are just 15 criteria, and then
Mhm.
out 5 out of 15 is just
Mhm.
effective communication, and then eye contact and something like that.
Mhm.
So just 10 points is the most
Mhm.
important thing each one case. So just focus on this one. Other than that, you should be yourself, and you should be confident as a dentist.
Mhm.
So yeah, I also overwhelmed as OSCE because I didn't have any good example
Mhm.
before. So I actually use another like tutoring and information as well. But
Mhm.
I combined all the information by listening exam experience session as well.
Mhm.
So, and then I pick up a good point from them, and then I merged my experience. So I create my own way,
Mhm.
and so that I can, and also I try to enjoy conversation with examiner
Mhm.
like I did, like I
Mhm.
practice. So
Mhm.
I would say that's helped very well. But so daily practice, I didn't have specific study partner. And
Mhm.
also I also say it's not compulsory to pass
Mhm.
the exam. From
Mhm.
time to time, I practice with my friends, sometimes ADC candidate, but just few times for each. And also I have the English teacher, online teacher. I ask him to listen my explanation, just listen. No, just
Mhm.
sometimes it's easier for me to like practice myself
Mhm.
by being listened by someone else.
Mhm.
So I break that apart as
Mhm.
yeah, and then so that's
So
how
with
I
respect
practice.
to the practice, like you said that you weren't having any OSCE partner as such on daily basis or weekly basis. So how did
Oh,
you know that you were on the right track?
Yeah, so the more I like listen the exam experience session and your reading material, and also sometimes I practice with ADC another candidate who are on third attempt floor, and then I little by little realize what is important for ADC OSCE communication. And then, but in the last month, I had a session with you, and then your advice like fixed my analyze for ADC exam, and then I have and then that's
All
how
right,
I.
thank you for that. So basically summarizing the answers that
Doctor, can I
yes,
just
please.
add one thing,
Yeah,
if
please.
you don't
Yeah,
mind?
of course.
Now, I just want to add something because that I'm thinking as the people who are not doing the exam, I want to clear things which was not clear for me. I don't know if people know this because I didn't know this. Now, I asked you also, I remember. Now, the exam is information gathering, diagnosing, and treatment plan. Room 1, 2 is information gathering. Room 3, 4 is diagnosing management. 5, 6 treatment plan. The rest is also related to treatment plan. Now, how do I know if I'm doing well in any station I'm getting in is when I go into room 1, I know it's information gathering. So I focus mainly on information gathering. Ask as many questions related to the case as possible that can help you to diagnose the case. Diagnosing, getting the diagnosing right, and management, of course. Treatment plan is getting the treatment to the patient correctly and giving the treatment options. Focusing about these points, they made a huge difference to me during my second attempt because I didn't know that in my first attempt. So
yeah, I think
I
you
just want to
asked me
clear
that,
that.
like, how would I know which station
Yes,
I'm going into?
exactly. I didn't know that
Okay,
the first time. So the second time, it made a huge difference because now I know what examiner is expecting from me when I go into the room. He wants me to ask questions or he wants me
all
to
right.
diagnose. So just to clear this, just for some
Yeah.
people.
Okay, all right. Thank you for that. So basically what he means is that because you have 10 stations on the clinical skills day, 6 of those are communication, 4 of those are technical OSCEs. So you won't know from the ADC side that this is a clinical information room or this is a diagnosis management room. What he means to say is that you can assume it. How would you assume it? Is that because the first 6 rooms that you go into are communication OSCE. So for example, your first communication OSCE station is station room 3. So room 3 automatically means that it's a diagnosis and management station. Room 4 means it's a diagnosis and management station. Let's say you enter room 6. Room 6 is clinical treatment and evaluation cluster. You enter room 1. It's clinical information gathering station room, all right? So ADC is not going to tell you that these rooms belong to these clusters, but you can analyze it yourself because the first 2 rooms are the first cluster, the next 2 are the second, and the next 6 are the third one, which is the clinical treatment and evaluation, all right? 2 of those are 5, 6 are communication, the rest 4 are technical OSCEs. Summarizing their preparation strategy, again, there is not a compulsory requirement to have an OSCE partner. You can practice yourself, of course, and that has worked a lot for them and other candidates as well. Memorizing cases is never a good idea. That's why when we have given the cases in our course portal, we have strictly advised, please don't memorize, get an idea out of it because you cannot memorize and present a case. If the examiner gets a hint that you're memorizing and you're presenting the case, that's probably a straight fail, all right? Other than that, practice makes you perfect. The more you practice, the more idea you have about the communication, the more you are yourself when you're presenting to the patient, the more you act as a dentist rather than a student in front of the examiner, the greater chances of you having success in the communication OSCEs. Now, coming on to the last aspect, that is the technical OSCEs. Candidates usually panic that at home we don't have all these things, even overseas candidates, we don't have all these materials and equipment. So what is your idea about technical OSCEs? How did you practice? And what are the things that the candidate should consider with respect to technical OSCEs? Dr. Tahar, you can start.
Yes, sure. Now for the technical OSCEs, I depended on 2 things. First of all, the videos again, in the portal. Secondly, I took 1 day comprehensive technical course before my examination, and that was literally 2 days before it. Technicals are really easy things, except the thing that I always struggled is timing, especially with pressure sealant or with rubber dam. So timing is really important. So that's what I used to practice before the exam. I used to do the task as much as possible with the 10 minutes that is provided for me. Now, can I talk about my tasks, doctor?
Of course.
That I got. Okay, so in the first exam, I had Fisher sealant, I had the matrix band, and I had the anesthesia, LA, and the fourth one, radiology, which was a bite-wing X-ray. I failed in the first exam in the Fisher sealant because I ran out of time. And the second time, I also got Fisher sealant, and I thought I did a mistake. I even talked to you about it. If you remember, I told you I did the task while I was standing, although it was on the upper, and I did it direct on a direct vision. And I thought I was gonna fail that because I did direct vision, and actually I passed. The second thing that I want to mention is I did not change the light, which led to my Fisher sealant set really fast. And I also thought I will fail because of that, but I passed. Now, why am I mentioning this, doctor? Because I just wanted people to know the things I didn't know is it doesn't, if you do a minor mistake, do not consider it as a fail in the exam. Yes, you might fail if you do major mistakes, if you treat the wrong tooth or whatever. But if you follow the same steps, I even in my Fisher sealant when I passed, I remember I didn't even check it on the, and I know there was some excess of Fisher sealant on my tooth, yet I passed that task. So I'm mentioning this, just do not stress out about the little details. Yes, it's important to try to do everything perfectly, but I don't think anyone would be able to do the exam in a perfect way.
Yes,
We'll all
the
do
thing
mistakes.
is that the mistakes that are considered as a daily routine, like for example, doing things while standing, missing to change the light, and certain minor errors, ADC examiners, they are also clinicians, or they were clinicians at what point of their life. So they don't consider this as something major to fail a candidate. You understand? And you have already experienced this because you cleared that station in your second attempt, the Pitt and Fisher.
Yes.
So not changing the light or doing the task by standing and other minor details that candidates usually ask me, they're not considered major. But yes, of course, let's say you forgot to etch the tooth. You forgot to, let's say, do the task on the tooth that you have been asked, or you forgot to, let's say you handled the mannequin or the cheeks in a weird way, which should not be considered clinically acceptable. So the examiners are looking at these things because they're clinicians. As far as you know the basics, as far as you know the protocol on how to do the task, you are quite safe in the technical OSCEs. And the biggest margin of error that you have in your practical exam is the technical OSCEs, because you have 6 stations on which you are judged, which is the clinical treatment and evaluation, 2 communication, and 4 technicals. So if something even goes wrong in one station, it does not really make a difference, because I remember that in the first attempt, you failed the Pitt and Fisher, but you cleared the cluster as a whole, right?
Yes, I did.
So the thing is that even if you have 1-2 mistakes, or you feel that you haven't performed well in a particular station, it's not there to panic and, spoil your day.
Adding to that, doctor, on my first examination, of course, I only filled the information gathering. But if you remember, I showed you my score. I passed, for example, in the information gathering, I failed room 1, passed room 2. In the diagnostic management, I failed room 1, room 3, passed. Each cluster, I failed one of the rooms. Yet I passed all the clusters. The only thing is information gathering. Although I passed one and failed the other one, I failed the whole
but I think you realized why did you fail in the information?
I did a major mistake by then, and I told you about it. So the mistake's different.
That's fine. So Dr. Wakako, what would you like to let us know about the technical OSCEs?
Yeah, technical OSCE is, I also say, I can also say it's necessary to take some on-site course, because it's mannequin is so different, and then you should practice, especially like infiltration, like LA and X-ray, to be familiar with the mannequin.
But how much would you expect the candidate? Like take a day or 2 would be sufficient?
One day. It's
One
okay.
Well,
One day or two.
that's the thing that most of the candidates that I recommend is that whatever tasks you can practice at your clinic or home setup, try to do
Yeah.
that. And then close to your exam, it's better to attend a one day. I usually send candidates to Dental 101, and I think Dr. Taha, you also went there because we
Yeah.
have good relations, and I know the doctors who are treating them.
Yeah.
A few of the mentors have been my candidates in the past, so I usually refer candidates to them. And I personally believe that we had now it's the numbers are, I don't know, past 400 or 300 for the practical. And this is how they have approached. Practice a few times at your house, whatever you can, or your clinic, and whatever you can't, make sure that you have a one day booked, more than enough. You can have a demo, you can have a practice, and that's what you need about technical OSCEs. Yes, please continue.
Yeah. So I practice as Mustafa mentioned, like fissure sealant and rubber, that means the station we can't finish in time. So I practice by myself like last 2 weeks or so, and then also to practice syncope and then CPR in my room. But other than that, I practice the LA and then extraction, X-ray with on-site course. But and also we can do practice in the scaling in my room as well. But I didn't. But yeah.
Okay, all right. Thank you for that. Thank you for sharing the strategies on how to prepare the exam. Just probably a few more minutes with the exam experience, like both of you sat the exam. How was your experience? Like, let's start with technical day, problems faced, the environment, and the stress. How to have the stress in control.
Well, I would like to talk about the things that happened during we know the tasks. We know that we will get a crown prep, we'll get composite amalgam cavity prep and temporization. Now, in my examination, there was some new teeth that were added, and we talked about them before the exam, doctor. It was a crown on a premolar. And endo for a premolar and also for lower molar. In my case,
I think
I
that
got the
was
lower.
added a few days before your exam date. Yes.
Yeah, just before my exam, which they added it. And I got the lower molar. I was a bit stressed because I never practiced a lower molar. But again, I just followed the criteria of just finding the drop, finding the canals, and making sure everything's all right. Just to add something up, because I know many of you did not even train on lower molar yet. When you open up the chamber on the lower molar, there will be a huge pulp nerve pulp tissue, which I asked the examiner on the day exam. I told him there's pulp tissue inside, which I cannot see the canals because. He was not clear about his answer. He just told me that I want to see the canals. So what I did, I removed the whole pulp, which took some time, which took around 5 minutes of my time. Luckily, I passed the endo, but it is not complicated. It's not really hard. I hope 101 Dental, they provide the lower molars now, do they?
Actually, they do, but it's a 2-canal one. They still haven't included the 3-canal. And as you
no,
mentioned,
that one is
was
definitely
3-canal.
3 canals. Definitely 3 canals. It was
And
for
how
sure
did
3
it go
canals.
about the premolar? That was also the first time that you were doing it on the exam, right?
The premolar, I didn't get premolar, doctor. No, I just knew before the exam about it, but we practiced one tooth. I remember one dental they had, not one dental, the academy in Dental 101, they had one tooth. Exactly. We were around 6 students and we were working on one tooth, which was the endo premolar.
No, I'm talking about the crown preparation.
Also, I didn't get the crown prep for the
you didn't
premolar.
get the crown preparation.
No, I got the central.
So the thing is that what I believe, like just summarizing what you said, is that even though you practiced the endo for the first time on the day of the exam, like the first molar, it was your first time that you have ever seen that tooth and you have opened that tooth, maxis cavity, and you still managed to pass it. So the takeaway point from this is that if you know the criteria, I believe it does not really matter which tooth you get the task on.
Definitely
because the
does not.
criteria does not change. Let's say you get a lower premolar for crown preparation or a canine or a lateral incisor. You still have to follow the criteria, which is 1.2 mm margin on buccal, 0.5 to 1 mm in palatal, reductions of 2 mm on incisal, 1.2. So these criteria don't change. So if you know the
Definitely.
criteria, if you know how to use your handpiece, if you know how you have a good hand control, it does not really make much difference even if you get a new task. The candidates usually panic because it's the hype that has been created. The media, the Facebook, it creates a hype, right? So I usually am very much against that, because if you have the basics, if you know the criteria, if you know what you're going to do, then it does not really make much difference. And there is a proof here with Dr. Taha, who had a task for the first time. He's opening a task for the first time, doing it for the first time in the exam, and he cleared that task. All right, Dr. Wakako, can you please share your exam experience on the day of the exam with technicals?
Okay, technical, like, yeah, actually, I was confident it's technical, but the question is more difficult, more than I expected. And then especially I usually starting from composite resin and amalgam. And then the composite resin box is so deep and the teeth are tilted. And then the first I create a big ditch, and then I remove the composite resin. It takes so long. And then, yeah, so but I try to be calm and then just do stick to the criteria. And then, yeah, I spend more time for composite resin. And then the regarding amalgam. So amalgam, I got 3.6, but the 3.5 and 3.4 is rotated. So margin, so I was struggling with the like because the marginal reach should be higher than it was supposed to be. And also I was struggle with the contact point. That I can create contact point, but it's difficult to set the contact point in the right spot because the teeth is rotated. But I eventually passed all the technical tasks. So I think stick to the criteria, and then you should know what is the major fail, what is minor fail, not minor, like just reduce the point. So even like just be calm and stick to the criteria, what criteria you should prioritize. These kind of thing is important. And then like in the last minute, and I usually do a PFM and a provisional crown. And also I realized that my first provisional crown is not good, maybe badly failed. So I created the PFM in last 10 minutes. And then I was in the last part, in the last half 3 hours, I was so in hurry. And then but still I still calm, because like I know which I have to prioritize. And then so even, yeah, so don't be give up until in the last second. Yeah.
Yeah,
So
that's
I
true.
was,
The
I
thing
felt,
with
yeah,
this,
I felt,
yeah,
yeah,
the
I
thing
felt
with this, yeah, please continue.
sorry. I felt I fell with technical, but I eventually passed all the tasks. Probably because I set my standard very high in daily practice. Yeah.
That's very good, actually. If you're following the marking rubrics, you're analyzing your task according to the marking rubrics. So even if you make a few minor mistakes, let's say, it's not necessary that the ADC is going to mark you down. But again, like I said, the examiner who is assessing you is a clinician. So if, for example, your restoration, your preparation, crown preparation, your provisional is clinically satisfactory, that's what he's looking for. So he might, just look over and ignore any minor mistakes that you might have made, because the overall thing is the most important. And that's what we usually tell the candidates, that when you're practicing, please practice according to the marking rubrics. We have assessment videos in the course portal, stepwise how to assess your task. A last question before that. After that, we'll
Doctor, I'd
just,
just like to add something regarding the technical, if you don't mind.
yeah.
Now, just for the mistakes I also did was amalgam. I had a ditch on the amalgam, which I just wanted to know that you can fix it. Even if you're done with the amalgam, you can get small scraps of amalgam, put it and burnish it. I also had a mistake with my composite, which I had an open margin, like a 0.5 millimeter open margin on the buccal side. I had a premolar upper composite, buccal with buccal extension. So I also fixed that by using a flowable composite to fix that. One of the mistakes that I thought I also did is when I went for the break, I left my tray open with the sharp instruments in. I do not recommend leaving it open, but when I went back home, I called the examiner and I told him that I should have closed this. I don't know if it's made a difference or not. The other infection control issue I had is my temporary crown fell on the ground. So I just raised my hand and I called my the examiner. I told him it fell on the ground. He told me what you should do. I told him that I would ask my nurse to change her gloves, pick up the temporary crown, throw it in the medical waste, and then we'll make a new crown. And he started asking me, why don't you just use the same crown? I told him that's infection control breach and blah blah. And he told me that's all fine. The other mistake I did, and I've done this mistake in the exam as well, while I was adjusting the amalgam, I forgot the burr in the handpiece. So when I moved my hand, the whole handpiece with the burr fell down, which was very scary to me. I was like, I'm gonna fail the whole exam because of this. Because honestly, I didn't know what to do. When the examiner came, I was like, what you gonna do in this situation? I told him that I will ask my nurse to take off her gloves, take off the handpiece, and I myself will take up the sharp instrument, and then we'll change the handpiece. And I don't know if I was convinced, but I passed infection control, so I think it was the correct answer.
All right. So just looking at the opinions that you are presenting here and your experience, despite having these minor errors, you still managed to clear the technical day and the infection control. So the thing is that you knew the right way to fix it if something is going wrong. You knew the right way to answer to the examiner if you do something that is, out of the control, like the handpiece falling on the ground, the provisional dropping on the ground. These are natural occurrences. This happens to us at the clinic as well. So this is not something that will fail you. But yes, if you say that you will use the same provisional crown on the patient, that's something that is wrong, right? You have to tell them that you have discard, make a new one. That's what clinically is acceptable, and that's what they expect from the candidate. Yes, you were saying something.
No, I just want to say yes. I just want to say that even if we do mistakes, it can be fixed. Just fix it. Do not stress out that you're gonna fail the whole thing. By the way, amalgam wise, I'm a really bad amalgam restorative person. I never did amalgam in my life, and my carving is the worst carving for amalgam you can ever see. But the thing is that even in the exam, I didn't do a really good carving. I only got my cusp, I got my margins, and I got well-sealed margins for the amalgam, and I passed it. So I just want to.
So you made your restoration clinically acceptable, not aesthetically acceptable.
Yes,
That's what the candidates do. They want the task to be aesthetically acceptable. Aesthetics, no one cares about. How your task, no one cares how it looks. If it is clinically acceptable, that's what is the main thing, right? Because they are training you and getting you a pass certificate to practice on patients. All right. Now, one last question I'll ask both of you, which you can answer in sequence, and then we'll have 5 minutes if any candidate wants to ask anything. Now, the thing is that you also know that the passing percentage of the practical exam is not too high, right? Probably around 15-20%. Every year, if 200 candidates sit or 500 candidates sit, maybe around 60 to 80 candidates pass the exam. So what is that sets apart a passing and a failing candidate?
I would say, doctor, how you approach the exam. You just need to approach the OSCEs as if they are patients. Do not complicate things. If you fail one room and you know you failed it, you're not going to fail the whole exam. I'm a big example on that. And you know my last score. I failed many rooms, yet I passed the clusters. Managing your stress is the most important part of the whole exam. Do not overcomplicate things. The exam is not a complicated exam. It's a very straightforward exam that is very clear to you. And trust me when I say that they help you a lot in the exam. They try to make you pass the exam. The examiners or everyone, they don't want you to fail. This is how I felt. Like they want you to pass the exam. They try to help you as much as possible. So overcomplicating things, and this is what I faced with the people who did the exam on the same day that I did, who failed the exam. They overcomplicate things. They make things that it's impossible to do. So I think managing how you approach the exam is the tip that would differentiate between a person who would pass this exam and a person who would fail this exam. That's the only thing. We all do the same thing. We all study the same materials. We all do the task the same thing. So the thing that differs is your persona or how you approach the exam. That's basically it. That's what I would say.
Okay, all right. I'll just continuing with you, and then I'll just ask Dr. Wakako about her. Now, the thing is that you know that the social
go ahead.
media and the
Can I say?
internet. Dr. Wakako, I'll just get back to you in a minute. I'll just ask another question, and then you can reply to both questions. So, yeah, you can just continue now. I'll ask the next question later. Yes, Dr. Wakako, please continue.
Okay. I think the motivation is the most important thing, because how serious the candidate towards the exam is the most important, because which affect the daily practice. I think this is all about practice. If it's like a sport, because like this is like a muscle memory, and then just practice make you confident. And yeah, but motivation like is necessary for practice every day. So motivation is the most important. And also the second thing is the think by themselves. Even if like I see a lot of candidates have enough information, and they already have enough information, there are enough like examples and example answers, but they still try to get answer from outside. But answer is like there is no specific answer, correct answer. Just be yourself, and then they are checking your customer service level, and then how you are familiar with these tasks. So yeah, I think so this is all about practice and motivation.
One more question that I would add is that, like the social media, the internet, and all this creates a hype, and then the candidates is just confused. Like some candidates are attending 5 courses, some are attending 4 courses, some are attending 3 courses. So, what is your recommendation towards that? Like, is it necessary to be part of like 3, 4 courses, rush up towards the academy and just practice and practice, enroll into the courses, and practice for weeks, take the lengthy courses? Like, what is your opinion in regards to that?
Definitely do not go through many courses. That is definitely because at the beginning on the first exam, I also tried to look for sources outside of the portal, and that only messed things up. So only follow up one source, because if you're gonna, for example, if you have, let's say, if you're dealing with Dr. Riza and Dr. X, Dr. Y, you're gonna be like all over the place. You're not gonna be in one point, and everyone has his own opinion. At the end, it's not about the mentor. Yes, the mentors do play a role in guiding you to the exam, but it's not the mentor. It's you. How you approach the informations and how you just calibrate it to the exam itself. So no, I would never suggest, because I did that mistake. I would never suggest going through many mentors. Please go on with one school and work on yourself. That's basically it.
All right, Dr. Wakako, you?
Yeah, I agree with that. And then like just but Skillsky, I needed on-site course, so just 1 or 2 is best. Yeah, and then but Skillsky, I would say I needed the on-site course as well, but otherwise just 2 is enough.
Okay, all right, that's fine. Thank you for that. So, any candidate would like to ask questions from Dr. Taha and Dr. Wakako regarding practical exam, or any question regards to that? You have the next few minutes if you would like to. So no questions. Everyone is prepared perfectly. Okay, so we have one question from Dr. Neha. Did you attend a mock? Yes, Dr. Mustafa had a mock done, I think a few days before the exam, and he practiced I think like 2 days or a 1 day course before the exam for the technical OSCE, and then he had a mock exam as well. All right. With regards to Dr. Matthias Martinez, we have asked whether it was a lower molar. Yes, Dr. Mustafa had a lower molar endo-axis cavity, which is 236 and 46. They have introduced this task since last month. Usually it used to be just the upper molars, which was 1626, but recently they have included the lower endo, which is 3646, and the upper premolar, first premolar endo task as well. All right, so these are the tasks that you should also practice a couple of times at least to have the feel of how the tooth is. Uh, Unfortunately, the One Dental and Nevada, they might be out of stock, but probably they will be available. And the thing again is that it's more about how the task is approached. It is the same basic rules and the marking rubrics that you practice for the upper molars have to be done for any other tooth which is asked for the access cavity. All right. Any other question, please? Anything that the candidate would like to ask? All right, that's fine. Thank you, Dr. Taha. Yeah, someone has a question? Yes, please.
Yeah, as I know, the technical skill of course of the Dental 101, they are asking me to bring my own instrument to attend the course. So for the Dr. Wakako, I know she attended the course, and did she bring Dr. Wakako, did you bring your own instruments?
Yeah, I did enjoy Dental 101. Because I based in Sydney, the course I took didn't require me to bring my
I think Dr. Taha, were you asked to bring your instruments and equipment
Yes,
with you?
Dental 101, yes. The only thing that they provide you is the mannequin head, and that's it. That's basically it. You
Even
need
for
to
the
bring
technical
everything with you.
OSCEs.
Even for the technical, they only for the rubber dam, I think they had only for one for the demo. But apart from that, yes, they ask you to bring everything. Now, in case you're like me, you don't have these instruments, I had to go there and buy it from them. So they have some items for sale.
So basically,
So you
if you
can
don't
buy
have
them.
the instruments, you can get there at the academy itself. So you don't need to worry about it. If you have yours, carry in with you. If you don't, you can always purchase it at the academy. All right. Any other question, please?
Okay, and as Dr. Wakako said, the technical test in her exam, the tools are rotated. So so did you really rebuild the contact, or you just let the contact open?
No, I put the contact, but contact was higher than I expected because the neighboring teeth is higher than normal because it's rotated. So, but I try to set the margin which is the same level to the neighboring teeth, and then I try to create a contact which snap the frost snap, and then yeah, that's all I did, and I passed exam.
All right. The thing is that whenever you have such a problem that, let's say that your tooth is supraerupted or rotated or in a weird way, it's always a good idea to convey this to the examiner before you start doing the task. What they do is they take picture, all right, and they already have that in record. So for example, if your contact is buccally or lingually or incisally, occlusally, or gingivally shifted, they already know that you were facing a task where the adjacent tooth was not in the ideal position. All right. So they're not going to mark you for that.
I think ADC on purpose, do it on purpose.
Probably, maybe, yes, they do it on purpose, since I've heard this, that the distal contact of amalgam is also usually the adjacent tooth is quite far. It's difficult to create. So certain things they do it on purpose, certain things because of repeated usage of the same jaws in the exam. Of course, they don't give the candidate the new jaw every time. These jaws have been used by many candidates in the past in the exams. So the jaws, sometimes they are not like 100% efficient, the way that you expect it to be completely new. There might be certain on and off things here, they're wrong. That's perfectly acceptable. The examiners and the assessor, they have the pictures of your jaws, so you don't need to worry if something is going to go wrong. You just have to make sure whatever you can do best in that particular task, that fits yourself in the marking criteria. All right. That's how you have to
And-
approach. Yeah.
And also I also like did 2-1 preparation, and 1-1 is tilted towards 2-1. I think it's also on purpose. But yeah. And then so that we cannot compare with the control activities, but just go with the criteria. That's it.
All right. Someone is asking, is loops necessary for the exam?
Definitely yes.
What about you,
Loop
doctor?
Well, if you don't have loops, it's okay. I'm just gonna answer that question.
The thing is that, in my opinion, with so many candidates, the thing is that you see what you're comfortable with. Of course, loops are magnifying aids. They will help you. But if you're comfortable doing the task without the loops, there is no harm in it. It's not a criteria which distinguish between a pass and a fail candidate. That's not the criteria. You have loops, you're comfortable with it, you have been using it, use it. If you don't have loops, you want to try it and see how it makes a difference to your task, use it. If you don't have loops, you don't want to use, you're still comfortable with the task, carry on as you're going. All right, so it's all personal preference. Some candidates use loops for certain tasks, some candidates use loops for all tasks, some candidates don't use loops at all. So it's not a criteria to pass and fail. I know personally a lot of candidates, even last session we had Dr. Omar, never used a loop, all tasks done without loops, clear, straightforward, clear access, all past tasks. He passed all technical. So it's not a compulsory requirement. If you have, you're comfortable, use it. If you have, if you don't have, you want to try it, use it and see how you feel. If you don't have, you don't want to use, you're still comfortable doing the task, perfectly fine. You can carry on. All right. Any other question, please?
Okay, and
Just
I
one-
want to
Yes, Professor.
continue with the party index problem. No, about the content. In the temporization of the task, the marking rubric said that we must have a good context. So if the original TIFF is originally open context, then our party index will be open context, right?
Yeah.
So what our final work should be? Should we fix the open contact problem, or just let it open? Thank you.
You're talking about the crown preparation and the provisional, right?
Yeah.
Okay. All right. Now the thing is that, for example, you have a task, let's say upper canine, and you feel that the first premolar and the canine are not contacting. Let's say. All right. Now the thing is that the first thing that you should do is to tell the examiner. Usually the examiner will say, do it how you will do it clinically. That's usually their answer. Or I cannot answer this. They will say something like this. They will not tell you that they will change the tooth for you or something. If they do that, that's good. Maybe if there is gross deficiency or gross malformation, they will change the tooth for you. But let's say that they don't change the tooth and they tell you to proceed as it is. In that case, when your provisional is made, it should have a contact.
Okay, right. Thank you very much.
You cannot leave the provisional without a contact because you don't know the intention of the examiner. So in my opinion, always try to do the task with the contact established for your provisional. You cannot leave
because
it
I think the marking rubrics, it has a mark on the contact. So I think it's really important to restore the contact.
Although the contact would be a bit abnormally shaped, which means that it might feel like a bit over contoured and you already had a pre-existing space between the canine and the premolar, but let that over contour be there. The contact is more important than the contour if you look clinically. All right.
Thank you.
Any other question?
Can I answer the comment?
Yes, please.
Like someone mentioning the English teacher, like I have been taking online English, like just normal one, usual one, just for my like daily task, like for my English. And then and then he's usual teacher and he can do anything, but I asked him to just listen to explanation so that I can make
so
at
that
least.
Basically you did it for your English skills, not related to ADC.
Yeah, so and then also like I can do whatever I want in the English lesson. So I asked him to listen my explanation, whether you can understand or not, like he can understand or not. That's it. So they just practice. Yeah.
All right, that's fine. Any other question, please? All right, that's fine. Thank you, Dr. Taha and Dr. Wakako, for spending time. And getting the questions answered, helping the
I found
candidates.
another question.
Yes,
Can
please.
we use loop and change to normal safety glasses for different? I think so. Yeah, because as long as you can like deglove, hand hygiene, and then yeah.
Okay,
Yeah,
can we
so-
use loops and change to normal safety? Yes, you can do that. You can just take off the loops and then place it in a drawer, sanitize your hands, wear the normal gloves, wear the safety eyewear, and continue. So you have to follow the infection control procedure. You can carry the loops. You can carry 2 loops. I know candidates who have carried 2 loops, 2 safety glasses. So you have a drawer designated for that. Keep the things there. Whenever you want to change, just make sure you follow the infection control procedure, change it, and keep practicing.
And then just so aware, if your like battery of light is not long lasting, you can use a charger in the exam.
Yeah, if your battery runs out, I think in the common area, you have a charger where you can charge your light, right?
Yeah.
All right, that's fine. So thank you for that, Dr. Taha, Dr. Wakaku, and hopefully we are done with the registration soon. And if you need any help around and any help with the APRA, more than welcome to message me anytime. All right, thank you for your
Thank you,
time,
doctor.
and thank you for helping the candidates. Thank you so much.
Thank
Have a
you.
good night.
Thank you.
Take
So
care.
much.